Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'll be sharing a recent initiative that I've been working on with some colleagues called the AARP Age-Friendly Social Innovation Challenge. This is a 10-part special series, and today we're going to be talking about Part 8, which is long-term care workforce and caregiving. So this series is related to several regional events that we've held at George Washington University Center for Aging, Health, and Humanities with our 5 regional age-friendly municipalities and our multiple partners. If you missed the overview, please check out Part 1, which is episode 89 if you're looking for it on my website, melissabphd.com, or you can find it on my YouTube channel. So in a nutshell, the morning session was spent learning about design thinking, and then our participants were paired by these different domains. And the domains are reflective of the World Health Organization and AARP's framework for age-friendly cities and communities. And as I said earlier, this episode is focused on the long-term care workforce and caregiving. And there are a lot of issues related to these concepts in this domain. And in order to focus the group's thinking and problem solving, a scenario was designed by our design thinking team. From there, the group devised 5 different ideas for a way to solve this problem, and then they chose one to present to us as an innovative solution. So as you listen, you may have an idea for a solution or know of a program that would help older adults and their families facing similar challenges. But right now, let's listen to hear what they came up with.
So in our group, we had leaders from DC, Arlington, Alexandria, Maryland, many who had lived in or spent time recently on the African continent. So they were poised to not merely offer solutions for Leonia's problem, they wanted to think in national terms within the global context. So let me just give you a sense of Leonia's problem, and then we can move on to the rest. Leonia was, of course, 58 years old, came to DC 4 years ago from Nigeria and worked as a home health aide. And she had been a hospital nurse in her home country, skilled and experienced, and this was very much recognized by our group. She didn't feel seen by her bosses. She felt a real connection to her patients, but found the work to be very hard. And she had difficulty with this kind of work and the limits our team felt it put on her. And she needed to find a way to care for herself, her family, while still being up for the challenge of helping her clients. Our team determined that Leonia is burned out and she's going to leave the field if we don't start listening to her and paying her more than an hourly wage. Working in a flawed long-term care system, our team found that she lacks a way to be heard, valued, and to advance in her career. So we innovated many solutions, long-term, short-term, and the group didn't want to settle on short-term alone. Our team passionately asserts that caregiver Leonia should be recognized as the essential worker she is, like a firefighter. Given the political moment, the time is right, they felt, to call for systemic change, as well as create a better individual situation for Leonia. This included becoming salaried and receiving local recognition, securing employer-employee communication, and having an expectation that there will be succession planning around the important work that she was doing. To begin, practically speaking, Leonia should have agency to tell her own story and to set goals that will place her on a career ladder. Our team felt very strongly that there were different levels of recognition that Leonia should have and people who are caregivers should have. People on the team had experience with offering rewards and awards to people in their localities and wanted very much to have leaders around the country, if not around the world, focus on the fact that home caregivers, some of them even unpaid, are essential workers. And they recognize that legislation is going through Congress now. So they wanted to go big before they went home. Thus, they have put in here that hourly workers, people who've been hourly workers for quite some time, should become salaried. And they wanted this out on the table right now. They also recognize that in different localities, DC being one, there already are efforts to recruit people to become caregivers for long-term care. And so this is succession planning seemed like a realistic goal. There are people in different housing localities that are recent immigrants that are seeking employment, and they saw ways that those people could be trained and Leonia could be trained so that she could use all the skills that she had developed in Nigeria to develop a better professional situation for herself and a greater quality of life for her family. There was also the recognition that she did not feel heard. So we wanted to begin by allowing her to tell her own story, to explain what was going on in her life, because we recognize this year has been especially difficult for caregivers, given COVID and all the other challenges that we all know. And so we didn't want to guess what kinds of challenges Leonia experienced. We wanted her and people like her to be able to identify these challenges and begin to work with their employers and the system that they were in to overcome challenges. When we talked about the short-term versus long-term, short-term was defined as 6 months to a year, long-term as beyond a year. So we hope that this will give people lots of food for thought around rethinking long-term care workforce issues.
I would like to thank all of our participants in this group for their time, effort, and energy. And as you can see, the group identified a variety of problems and ideas for how to meet the needs embedded in the scenario. You can also check out episode 69 with Dr. Mark Cohen, where he and I discuss the basics of how long-term care is paid for, and we talk about future trends for long-term care insurance. You may have another idea for a solution or know of a program that could help an older adult or their families facing similar challenges. Please add your comments below this video or on my website where this episode can be found at melissabphd.com. I'd love to hear from you. Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities.